Hi, my name is Pedro Sanchez, and do you know how many people are living not knowing what they will do if they wake up sick? Well, not everybody gets the same healthcare system or medical insurance as many of us do or others do. Especially the majority of the Hispanic community, they lack of healthcare because of fear that they will be discovered being undocumented, the amount it costs, and they are unaware of what medical insurances or benefits are out there for them. The reason why I decided to talk about this certain topic is because I have two Hispanic parents who are undocumented and have gone through this struggle and how it has affected me and my siblings. According to Elizabeth Fernandez, an emergency medicine physician at UCSF, around 24% of the undocumented Latino immigrants said that they are afraid to come to the ED, the emergency department, out of fear of being discovered that they are undocumented, meaning that they would rather stay home or not seek the help that they need to not be discovered that they are undocumented, basically, or immigrants. On February 24th of 2020, the Trump administration officially published a new public change rule, which basically allows federal immigration authorities to deny permanent residency to families who use Medi-Cal, food stamps, and other things, meaning basically that they will not get the benefits that they do if they have Medi-Cal, which is basically a system that was originally provided to the lower class or undocumented people, which is kind of absurd. According to the Pew Research Center, approximately 8 million undocumented Latinos lived in the U.S. in 2016, not that long ago. This was the time when the deportation became a cornerstone of the Republican campaign, which made it hard for many of these immigrants or undocumented Hispanics to come out and seek help that they really needed. When things are also very expensive, how can one try to go seek help? For example, my family, the way that they struggled was during my junior year in high school, we lost our medical insurance because of the fact that it was costing my parents roughly around $700 to $850 per kid, and we are 3 kids, and that's not even counting my mom and dad for their medical insurance. They would always tell us, like, do not play physical sports or do not go get hurt. Please do not get hurt. And there was times where we would get hurt as kids or during that time, and I would be like, no, I can hold off the pain. It's just a pain. Pain is temporarily. It will heal by itself within a week, hopefully. If not, I gave it another week, and probably after the second week, I would be like, okay, I think I need some like medical help. Just the fact that I didn't want to make it so expensive for my parents. The average cost for medical insurance monthly is around $570, and annually is around $6,916. Not being able to pay for these medical institutions or care that we needed was very expensive at the time, because my brother also got hurt during this time and he needed surgery. Luckily, I had a cousin who was in the medical field. She told my mom to ask the hospital about pro bono, which basically is a Latin word for the public good, meaning during pro bono that they would either do your medical work for free or for a significantly reduced price for the recipient, which is basically what happened to my brother. Because of not being aware of what pro bono meant, we didn't know that such thing existed. So many of the Hispanic community are not aware of what certain things are provided to them, such as the free clinics. An example would be the OC Healthcare Agency, which their goal is to basically help families that are undocumented in the lower class. The Affordable Care Act, the ACA, greatly expanded its insurance coverage for the low-income Californians through Medi-Cal and the state's medical program. But even though that happened, 60 to 70% of the undocumented immigrants who applied for it still lacked insurance because of the healthcare options that are so limited. There are tons of people around this world who are undocumented in fear of not receiving the proper medical care that they need. How can one make medical care so expensive for other human beings that are already suffering and struggling through so much? About 44 million people in this country have no health insurance, and 38 million have inadequate health insurances.